Today I'm going to be talking about dental practice models, and I am very excited about this topic because it's one of my dreams to actually see different practice models around the world. And so far, I've just seen India and United States. I feel like other countries could be similarly in between, but I definitely want to see other countries. I want to go to Canada, maybe UK, Australia, Europe, Africa. Let's just see how everything's working up there. And it's just a fun experience to see different practices, even in the same country. It's just nice to see how they work and how they operate. And when you're assisting or if you're a dentist, you would definitely ask somebody else, like, how is your practice? Or, as a patient, you could be like, how was your experience in that practice? So just to break it down, I feel like I can divide it into four sections. I would call it the private, the DSOs, where you can volunteer. So there's so many volunteer, dental volunteer organizations. And then you have your universities or the academics, like, into that portion. So with the private, I feel like it's very initially we had been detached with the medical field or like the hospital setting, and they have we or dental practices open their own private offices, and that's been a very good model for business practice owners or somebody who wants to be like a business owner too. um I love that practice model, but definitely you need so much support with handling so many other things, and that's when we have and cutting the budget cost. Definitely, that's a lot too. The prices have gone up and everything's expensive. Dental expensive too. So you definitely want to cut down your cost, and that's why you can have the next model could be like partnership with somebody else. So two people or three people, or how many ever people being partners in their dental practice. You have that partnership model within the private practice itself, and you can also have like you make your own, like you have your own dental practice and then you're renting it out to somebody for practicing. That is still under the private practice model. Maybe you're retiring and you're giving it to somebody else to practice, and still having the shares or whatever profits that you're sharing. um, that's also a good way. um, then we have your DSOs, your corporates. In the United States, you have big DSOs. You have Aspen Dental. You have Dental Dreams. I cannot think of more names right now, but it's definitely good to be seeing these models because I feel like there's so many options open together, like it is more accessible. And what if you have to go somewhere? Definitely the clinic is not shut, and a little bit more organized. Well, private practices are organized too, just depending on the person who is actually running it. Um, but that's also a good way of seeing. There's some um, DSOs where you can have a lot of waiting time. There's some who are like actually very punctual about time and treating getting in patients as soon as possible. And it's just that so much can happen in between, and your options are open. We're discussing this because you also want to see the lifestyle that you want to be practicing in. There are people who would join DSOs first and then have their private, or sometimes they just don't want to have the burden of actually opening their own practice, and they want to focus on working. They just want to focus more on clinical, and they don't want to do the business aspects. It's just a preference, it's just a choice, and it's good to have these kind of companies come along. And definitely with the prices very cost effective, you can bring in new technology all the time. And I would also include the community health centers within this, because in US I feel like there's so many community health clinics too, serving the underserved people. And they have multiple locations. um, I'm not sure about every state, but at least with the states I've been in, I've seen a couple of them. And it's very good to see those community clinics. I feel like you're in a hospital, but it's just like a dental hospital. Um, so it's so good to see those community clinics. Then you have your volunteering work, like, when you're going on field trips to actually different locations. And I have never been to different, like, volunteering kind of, I would say in India, yes, when you were in school, but I still want to be able to go to volunteering trips where you can actually go ahead and see more patients that way. Sorry, I think I'm forgetting what I'm saying up here. But yeah, definitely it's just like, volunteering work, some kind of volunteering work. And then you have your academics. I feel like hospitals, the universities, not hospitals, universities, they have, like, the dental schools, they would have good amount of patient flow. And people actually trust them even when students are still practicing, because I feel like there's so many faculties, there's so many other people up there to support them. And those organizations are very big. And they're still organized. And you have so much technology up there, you feel like the waiting is going to be too much. But I feel like in few universities you can still get that work done. uh, like, as a patient, I feel it could be cost effective too. And the students are actually taking out time making you understand why you need the treatment. It's so awesome to see students actually putting in the effort to explain them why, like, why you should be taking care of your teeth and why you should cut down on those habits. And it's just nice, like, that practice model is also nice. When you want to teach and you want to practice together in a location, like, what if you want to do research, or you want to do teaching and you still want to practice? I feel like that location is still good, because you're always aware about what's going to be coming in new. You, like, because there's so much research done in the academics, like in the universities. You be the first one to attend them, and I feel like that is pretty cool too. um, just depends on where you want to practice. But yes. And like I said, these are the four categories. I feel like these are the different models. It's just the lifestyle that you want, and what you're looking for. Depending on what you want out of dentistry, you should choose the different practice models you want to be a part of. And yeah, I hope we can come out with some other good content next time. So bye.